Next principle, principle number 4. It's absolutely critical, but virtually no one knows it, or at least for sure we don't act in our society as if we know it, and that is your brain is very soft, and it's housed in a really hard skull. Your brain is the consistency of soft butter, tofu, custard, somewhere between egg whites and Jell-O, and it's housed in a really hard skull that has many sharp, bony ridges. Brain injuries matter. They damage the brain and they can ruin your life. We need to do a much better job at taking care of our brains. The next principle is many things can hurt your brain. And many things can help your brain. So let's talk about that, because you want to know what it is. So what are the things that can hurt your brain? Well, we've already talked about a couple of them. Drugs, very bad for brain function. Toxic fumes, head injuries. Alcohol is not a health food. Now, I know many of you are out there and you're like going, gotta have my glass of red wine a day. Doctor says I have to do it. This is good for me. No, 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 no. The research really says 1 or 2 glasses a week can be helpful for you because a little tiny bit of alcohol tends to balance cholesterol levels. People who drink every day have a smaller brain. And I would just suggest to you that when it comes to the brain, size matters. You don't want a smaller brain, and alcohol is directly toxic to brain function. Lack of exercise. If you don't exercise on a regular basis, that's decreasing blood flow. It's very bad. You'll notice we're going to talk a lot about exercise. Not getting good sleep. People who get less than 6 hours of sleep at night have lower overall blood flow to their brain, and with that comes all sorts of problems. Chronic stress. I mean, we're living in this fast-paced society, often under a lot of stress. And if you don't have a stress management technique, this is prematurely aging your brain. Smoking. Smoking is a disaster for brain function. Now, can you tell the skin of a smoker? How? Dry. Dry. Wrinkled. Doesn't look healthy. Why? Because smoking constricts blood flow to your skin. It does exactly the same thing to your brain and prematurely ages it. And did you know too much caffeine can do the same things? Now, I already know some of you are going, okay, doc, how much can I have? And I have to tell you, 1 or 2 cups a day, it's not that bad for your brain. More than that, it's a nightmare for brain function because it constricts blood flow. It also dehydrates you, and it fools you into thinking you don't need to sleep. That's why as soon as you wake up, gotta have my cup of coffee in the morning, right? It's not good for you. You can do without it. Negative thinking is terrible for brain function. Isn't that interesting? That if you focus on what you hate about in your life, your emotional brain fires up, but your thoughtful brain gets colder. So you become unhappy and you make bad decisions. So how you think moment by moment determines in part how your brain works. Okay, now these are things that hurt your brain. Let's talk about some things that help your brain. New learning, like tonight. Whenever you learn something new, your brain makes a new connection. When you stop learning, your brain actually starts to disconnect itself. You always want to have a new project where you're learning something new. A healthy diet. You are what you eat. We're going to spend a lot of time in the last segment talking about brain healthy foods. Daily, vitamins and fish oil. We'll talk about that, as we will exercise. Exercise is literally the fountain of youth, and I'll tell you why. Getting great sleep is important. Social connections. Being with other people, especially if they're good for you. But going to church, being part of a family, being part of a hobby club, all of those things are important because when you're with other people, your brain has to work, right? You have to remember their name, and do they have kids, and what does that look mean, and all of that is working your brain. Positive thinking, especially gratitude. When you focus on what you love about your life, your brain works better. The emotional brain sort of settles down, the thoughtful brain goes up. You're actually more coordinated when you focus on what you love about your life. So a very simple exercise that you can take home. And they've actually found this to decrease depression in people who have clinical depression is just write out every day 5 things I'm grateful for today. 5 things I'm grateful for today. It can be your health, your family, your job, whatever it is. It can be your dog, whatever it is. Focus on it, because when you bring your attention to gratitude, you feel so much better. Interestingly, meditation is also amazing for brain function, and meditation fooled us. Those of us that are brain imaging doctors thought what meditation would do would be calm down the brain. It absolutely doesn't do that. What meditation does is it activates the most thoughtful part of your brain, so that you make better decisions, so that you feel happier, so that you're actually more intelligent. And did you know that making love is good for your brain? Regular sexual activity has been shown to be associated with decreased depression, so it helps your mood, it helps your memory, it helps in pain relief, so when she says, "Honey, not tonight, I have a headache," you can say, well, did you know there are 2 studies with migraine headache sufferers that say having an orgasm decreases pain frequency by 50%? I'm just here to help. And there's a study from England that says 3 times a week. 3 times a week is associated with decreased risk of heart attack and stroke by 50%. We have no medicine that can do that. Right? So many things can hurt your brain. Many things can help your brain. This next principle is really important. And that is, one size does not fit everyone. Most psychiatric problems like ADD, anxiety, or depression, they're not single or simple disorders. Giving someone the diagnosis of depression is exactly like giving them the diagnosis of chest pain. Now, why don't doctors give people the diagnosis of chest pain? Because it's a symptom. There are too many causes. The same thing is true for depression. It's a symptom with many different causes. Chronic stress, relationship problems, financial losses, head injuries, drug abuse, low thyroid, chemical imbalances, even grief. Our research at the Amen Clinics has shown that it is at least 7 different things. And giving everyone the same treatment for this symptom invites disaster. In the next segment, I'm going to tell you about a revolutionary brain-based approach that helps us heal problems like depression or ADD. We do it more quickly and often with natural treatments because we understand what part of the brain that we're dealing with. Now, the last principle, the most exciting thing that I'm going to tell you, is that you can change your brain and change your life. Your brain can change. On the television, you see 2 SPECT scans. This is a patient that came to see me because he had temper problems. The image on the left shows low overall activity. The image on the right, just after a couple of months of treatment, looks so much better. And as his brain got better, so did everything in his life. How exciting is that? You literally can make your brain better. You're not stuck with the brain you have, even if it's troubled. Now here's an image of a healthy brain. So this is from our very rare group of healthy people. You know, it took us almost 3,000 people screening to find about 90 healthy brains. So if your brain is struggling, well, welcome to normal. Okay, normal is not healthy. Okay, this is an 82-year-old brain, drop dead gorgeous, and it fit her life. Still very active, in church, with her family, married in a good marriage for 57 years. This is what a healthy brain looks like. Compare it to someone who had a stroke. Strokes are a disaster for brain function. This is why you shouldn't smoke. Did you know that smoking is the #1 cause of strokes? This is what Alzheimer's disease looks like. Alzheimer's disease ravages brain function. Now, our brain scans can tell 5 to 10 years before you have symptoms whether or not you're likely to get it.